Another question I often get, particularly when we talk about coronary artery disease and what it is, oh my gosh, Chef Dr. Mike, that sounds horrible. And it is. What things should I be looking for? What are risk factors I have to worry about? And they come in a couple of different flavors. So there are some risk factors that as human beings, we simply can't do anything about. One of the risk factors is simply getting older. As we get older, that puts us at an increased risk of coronary artery disease because, as I mentioned, it's a process of inflammation and particularly chronic, continuous, low grade inflammation. And so it develops over days and months and years and years and years until it finally manifests. So that simply means that as we get older, we get in a higher risk group. And so obviously we don't want to pursue the alternative of getting older. And so simply getting older puts us at a higher risk. So that's one of the risk factors. Because of the natural distribution and protective effect of hormones like estrogen and the effect of menopause not hitting women until sort of they're in their usually fourth to sixth decade of life, being male puts you at a risk at an earlier age because that estrogen seemed to protect women for about a decade longer. So as they reach menopause, females will then incur a rate, but at a delayed progression compared to males. So men, being a male, put you at a little bit higher risk at an earlier age. Certainly our family, our DNA has an impact on our risk as well. And again, it's simply the genes that we're born with can put us at risk because we can have abnormalities of cholesterol metabolism and other kinds of genetic markers or perturbations that can cause us to be at higher risk of developing that inflammation, those plaques, etc. And so that seems a little depressing because those are things we really can't do a whole lot about. But fortunately, there are a number of risk factors that we can do a lot about. So one of those, obviously, is our diet. And that leads into a very important risk factor for coronary artery disease, which is type 2 diabetes. Type 2 diabetes is a condition that really puts our whole body into that pro-inflammatory state, which sets us up for things, as we mentioned, coronary artery disease, but other types of diseases and disabilities that are associated with having diabetes beyond just the abnormal metabolism of glucose or blood sugar, as many people refer to it. And it turns out that when we look at things like diet, it not only reduces our risk of heart disease, but certainly reduces our risk of diabetes as well. So we get an extra bang for our buck when we eat well. So looking at our diet and controlling these risk factors for type 2 diabetes is going to reduce our risk for cardiovascular disease. And when we reduce our risk for cardiovascular disease, and we reduce our risk for type 2 diabetes, well, then we're reducing our risk for all the complications associated with things like that. Stroke is one of them that I had mentioned before. So adjusting our diet and paying attention to that, that's a very important risk factor that we can control. And to give you an idea how important these, what we call modifiable risk factors are, just looking at diabetes, Harvard University estimates that 9 out of 10, and you heard me right, 90% or 9 out of 10 of all the cases of type 2 diabetes, particularly what we call early onset type 2 diabetes, meaning they're really affecting our younger generations, people in their 20s, 30s, 40s, etc., can be prevented with lifestyle modifications like diet, like exercise, etc. And the American Heart Association estimates comparably, and because I've already talked about how these kind of fold together, diabetes and coronary artery disease, that 8 out of 10 premature heart attacks can be prevented, or 80% of those premature heart attacks could be prevented, again, by lifestyle modifications like diet and exercise. So diet is something we definitely want to pay attention to. Obviously, as a professor of culinary medicine, that's a passion of mine. As a professional chef, you can imagine it's a huge passion of mine. I have a great hunger for it, as it were, and you'll get all sorts of bad puns throughout this course. So I want to put that disclaimer in right now. But one of the other risk factors that we want to address is exercise. And you don't have to go to a gym to address that. We simply mean don't be so sedentary. Don't sit in front of the computer and do nothing else for 12 hours a day. Don't lay around all weekend and watch TV. So we want to get up and move. And so often when we talk about exercise, people go, oh gosh, I hate the gym. I don't want to go to the gym. I don't like sweating. I don't want to do this or that. But simply getting up and moving has been shown to be so, so important. So we definitely want to get up and be moving. And that's one of the risk factors we can address. And finally, one of the other that I'll touch on is high blood pressure, which is a risk factor, very potent risk factor for strokes, heart disease, etc. And again, that is something that can be modified by exercise and diet, which I've mentioned. But also, if your doctor has you on medications, make sure you take those medications. One of the reasons we call risk factors like hypertension a silent killer is because unless your blood pressure gets very, very high and you start to have symptoms, you really don't know if your blood pressure is in a range where we want to have some medications or other techniques to bring it down. For folks that are looking for things to get away from medications, if your doctor puts you on one, I want you to, have a conversation with your physician. But certainly we've seen, and I have seen as a cardiologist, folks who take that lesson to heart. They've been put on some medications for blood pressure. They go out, they change their diet, they lose some weight, they start exercising. And before you know it, within a year, guess what? They're not even taking medications anymore because they've been able to address those conditions, those risk factors in ways that we just talked about, meaning that they are modifiable. They're in your control. So well, we started out talking about risk factors that can be a little depressing because they're not really things we can do a whole lot about. I hope that what you've taken away from this section is the fact that there's still a lot that is in your control. So it's up to you to go ahead and be proactive and take control of your health.